answer the questions. First of all, let's invite Wang Jingsong to brief us about the epidemic prevention and control. Dear civilians and media friends, good morning. First of all, please allow me to present to you the updates of our city's epidemic situation. Firstly, about the increasing cases. On August the 10th, the newly added local COVID-19 had another 54 confirmed cases, 13 mild cases, 4 usual cases with no severe cases. For this moment, the accumulated reported confirmed cases amount to 448 in the city, and 447 were enrolled into the designated hospitals, with 73 mild cases, 23 heavy cases, and 12 dangerous cases. No asymptomatic carrier. As to their activities and traces, they will be shared on the WeChat account of Yangfan. According to the epidemiology studies, for the close contacts already screened out and their close contacts, we have quarantined them. And secondly, for the medical treatment, by the end of August 10th, 214 confirmed cases have received treatment in the 3rd hospital of Yangzhou City. For example, there are 154 usual cases and 223 confirmed cases were now treated in Nanjing City, with 26 mild cases, 185 usual cases, and 13 heavy diseases, and 9 dangerous cases. For this moment, all of the patients are receiving active treatment. Third, for risky level designation, the headquarters of the Epidemic Prevention and Control decided that since August, we have readjusted the level of risk of our city. The Qujiang neighborhood, Qujiang Xingyuan neighborhood, Jingzhou Weigu neighborhood, Hanjiang district, Hanshang neighborhood, Hanshang Happiness Community, Yingfu Community, Shuangqiao Street, and number 426 of Yangzijiang North Road, Jiangyang neighborhood, Shujing Huayuan Community, the Economic and Development Zone, Yangzi Street, Shunda Community, Huaizijing Zhuangyuan neighborhood, and the Shijinghu Scenic Spot, Yuxi number 22, were readjusted in terms of the risky level to be the intermediate level. And for this moment, we have 2 highly risky areas, 92 intermediate risk districts. And fourthly, about the nucleic acid testing. On August the 9th, we conducted the 5th round of the nucleic acid testing with about 1.5 million population participating, and we quickly blocked the channels of transmission of the virus. We safely guarantee the health of our civilians. At 6:30 this morning, our city conducted the 6th round of the nucleic acid testing on a mass scale. They have to prepare their health code, their identity cards, and according to the guidance of the community volunteers, they have to wear their official masks with other measures in place to have their samples taken. So they have to coordinate with the on-site staff members in the sample-taking process. The entire procedure was accomplished in an efficient way. And also with no adequate excuse, they could not conduct any behavior against the prevention and control requirements, and they will have to be held accountable legally. Now we open the floor to the media friends from the People's Network. What about the commodity price? Is it stable? And what about the supply of materials? Mr. Huang, please. Good morning, dear media friends. To continue our guarantee work of the supply of materials and price stability, the Municipal Level Development and Reform Commission has unveiled a document about further strengthening the commodity supply, and we require different localities to go all out to guarantee the food supply and the stability of prices. We have also set up a panel specifically dedicated to that task. We have kicked off the daily monitoring of the prices of commodities. We also publish the trend of the prices instantly. In the recent 2 days, we are communicating with the Department of Commerce to supervise the prices and the supply of food in major supermarkets. We also had an idea about the inventories in different neighborhoods. We have already realized the problems of the civilians, so we could come up with immediate solutions. We are also working with the Transportation Bureau by publishing a document about the logistics guarantee for the necessities in the city. We require different functional areas to observe the principle of responsibility and coordination, to introduce certain policies and to guarantee the transportation of the key necessities and materials. We will offer the green pass to those materials transportation. No entity can block the transportation of those necessities for the purpose of epidemic prevention and control. We must also guarantee the quality of the materials, logistics, services. For this moment, we have abundant supply of those key materials. The prices are kept stable, with even some going down a little bit. In the wholesale market, we are also observing the number of the materials in the wholesale market, mainly about 1,000 orders coming in and out daily. As to the inventories of milk or eggs and other key necessities, they are also sufficient to meet the market demand. The Municipal Development and Reform Commission also observe the on-site price supervision on about 50 sites. On August the 10th, the agriculture food market has seen the average price of 5.2 RMB yuan per jing of the key vegetables. For supermarkets, 10 vegetables are sold 3.8 RMB yuan per jing. Pork price is kept stable. For example, the pork price is about 18.9 yuan per jing on average. Eggs have seen a decline in their prices. Also, in the key supermarkets, the eggs are sold on average 7.7 RMB yuan per jing. That's a slight decline as well. Since August the 5th, the price of eggs come down continuously, and now it's leveling up. For this moment, we also see stable grape price, and they are kept almost at the same level as before the epidemic broke out. So please do not panic and consume as usual. Next question, please. From Jiangsu Radio and Broadcasting. Since the outbreak of this epidemic, what are the detailed measures taken by Yangzhou City to help those especially vulnerable groups? Mr. Xu, since the outbreak of this epidemic, we have paid close attention to the vulnerable groups in helping them. We have set up a quick response mechanism and come up with a series of measures to care for the vulnerable groups. Now, please allow me to present to you the details. Firstly, we establish a temporary rescue mechanism and emergency response system. For example, by giving the funds to the vulnerable groups, we also set up such an emergency response mechanism to target at the vulnerable groups. Such a mechanism is like a guarantee mechanism, particularly for those civilians who are elderly people living alone or children or who are accepting the minimum allowance of the cities. We had an investigation about those people. We have a daily follow visit through WeChat, telephone calls, or the calling upon their doorsteps. We get an idea about the situation of those vulnerable people, including their health status and their living conditions. For the affected families hit by this epidemic, we offer food, facial masks, and other supplies to those families immediately. We also try to guarantee that when they have any difficulty, they could have someone to come to. And by August the 10th, different civil affairs offices have visited about 10,979 people, and the people having difficulties responded actively to our help. We have covered about 1,600 people receiving the minimum allowance of the cities, 2,404 elderly people living alone, 352 children having difficulty. So we have also seen the quarantine of the difficulty groups, including one elderly person living alone, one family receiving the minimum allowance of the city, and 3 children having financial difficulties. So we have added up by some rescue measures coming to the instant help. For example, the notification immediately to different departments, asking them to streamline the approval process by identifying the technical standards and criteria of receiving such help. So we have to be aware about the instant needs of those difficult groups. In the key downtown areas, for the vulnerable groups receiving the minimum allowance and the children having financial difficulties, according to the criteria, we will dispose the temporary subsidies to them for their life's concerns. And for the disabled people, we will directly offer the minimum allowance for them for 3 months in a row. So it's a lump sum money for the families having their members treated in the designated hospitals. We will also launch the temporary provisions in the community level. We will lean more towards them financially, and we have to guarantee the rescue and treatment of their family members. For example, we have seen about 370,000 RMB already allocated for that purpose. We have also allocated 37,000 RMB yuan for the provision of supplies. By the calculation of 300 RMB yuan per household as the minimum allowance, we helped a lot of orphans and vulnerable groups. We also have sent the daily necessities like oil or rice to help about 500 households. Thirdly, we also try to guarantee that the people kept in Yangzhou could receive some help they commuted from elsewhere. Since we set up such a mechanism of helping those people traveling to Yangzhou and are kept and held here, we have received about 3,000 people asking for help. 284 people are treated, and we also guarantee 1,000 people receiving our supplies. Since August the 7th, we have called those people one by one, and sometimes we pay visits. Part of those people traveling to Yangzhou, we sent them a package of supplies. So those people traveling to Yangzhou will always have some staff members to come to when they have needs. Thank you. My question is, during this time, in addition to self-protection, many civilians are staying at home. How can we have more scientific solution during this epidemic? Fitness is a question for those people staying at home. With the rebound of this epidemic, we certainly need to protect ourselves by exercising. We can choose the suitable method to build up our immune system. First of all, if you want to exercise at home, you have to consider your age, your living conditions, to choose a suitable exercise. For example, for teenagers, you can choose activities like jumping, sit-ups, or running. And for the adults, you can choose planking, wrestling, or kneeling down against the wall, or yoga to keep your flexibility. For the elderly people, you can choose less aggressive exercises, for example, Tai Chi and the gymnasium. And also, for the fitnesses to be carried out, you have to warm up beforehand. Because for now, it's summer. During the exercise, you need to drink a lot of water during your exercise. And also, you have to consider your household environment, because it's after all cramped in our homes. Unlike the outdoor activities, try to keep yourself safe. Do not hurt yourself. And during the exercise, keep a good ventilation to avoid the concentration of bacteria. Also, time matters. There may be some noises from the exercises, so try to avoid the resting time to avoid undermining the neighbors. And also, it doesn't mean that the more the exercise, the better. Too much exercises may hurt yourself, like your heart. So, very strong exercises should not last more than 30 minutes. For mild exercises, it couldn't last longer than about 1 hour. As long as you have some perspiration, is already okay. So keep it a regular habit, but do not get too much exercises. And also, do not open the air conditioner immediately after your exercise. Otherwise, you may have a cold. We recommend you to take a warm bath after the exercise. That could relax your muscle and avoid catching cold. Also, have good rest. Enough rest, added by scientific exercise, you can guarantee a balance of your body. Anyway, during the epidemic, we cannot conduct outdoor activities, but for those people who love fitness activities, there are also ways for you to exercise yourself. You have to customize your activities and do them within the abilities and the environment conditions. Thank you. In the interest of time, this is the end of today's presser. If you have any other questions, you could come to the information office. Thank you for your participation.